Hi everyone, this is Nurse Anna from nursestudy.net. Today we're going to talk about congestive heart failure, often called CHF. This condition is very common, especially in older adults, and it's a major topic you'll see on the NCLEX and in nursing school. In this video, we'll break CHF down in simple terms so you can truly understand what's happening inside the body. We'll go over the pathophysiology, lab findings, nursing care plans, complications and priorities, patient teaching points, and finish with 5 NCLEX practice questions and rationales. Pathophysiology. Let's start by understanding what CHF really means. The heart is a pump. Its job is to push blood to the lungs and then out to the rest of the body. In heart failure, the pump gets weak and can't push blood forward the way it should. When that happens, blood starts to back up, kind of like traffic on a busy road when a lane is closed. There are 2 main types. Left-sided heart failure. The left side of the heart can't pump blood out to the body. Blood backs up into the lungs, causing shortness of breath, crackles, and sometimes pink, frothy sputum when the fluid leaks into the air sacs. Right-sided heart failure. The right side can't push blood to the lungs very well. Blood backs up in the veins, causing swelling in the legs, jugular vein distension, and fluid in the abdomen called as site T's. Some people have both sides affected, called biventricular failure. The main problem, because the heart isn't pumping well, the organs and tissues don't get enough oxygen and nutrients. The kidneys sense that and release hormones that make the body hold on to sodium and water, trying to increase blood volume. But this extra fluid only makes things worse, leading to edema, weight gain, and breathing problems. That's the cycle of heart failure. Weak pump, fluid buildup, even weaker pump over time. Signs and symptoms. Shortness of breath, especially when lying flat, orthopnea, waking up at night gasping for air, paroxysmal nocturnal dyspnea, fatigue and weakness, swelling in feet, ankles, and legs, sudden weight gain from fluid retention, crackles or wheezing in the lungs, jugular vein distension, neck veins bulge when sitting up, decreased urine output during the day, more at night, nocturia. Lab findings. When someone has CHF, the labs and tests help confirm the diagnosis and monitor treatment. BNP, B-type natriuretic peptide. This is the most common lab for CHF. When the heart is stretched and working too hard, it releases BNP. A high BNP level means the heart is under stress from too much fluid. Electrolytes, potassium and sodium may go up or down depending on medications like diuretics. Kidney function tests, BUN and creatinine. The kidneys may not get enough blood flow, so these values can increase. Chest X-ray shows an enlarged heart or fluid in the lungs. Echocardiogram, ultrasound of the heart to check how well it pumps. A low ejection fraction, below 40%, means the heart isn't squeezing properly. Nursing care plans. Nursing diagnosis number 1, impaired gas exchange related to fluid in the lungs, as evidenced by shortness of breath, crackles, low oxygen saturation, interventions, and rationales. Place in high Fowler's position. Rationale. Sitting upright lets the lungs expand more, so air gets in easier. Give oxygen as prescribed. Rationale. Extra oxygen raises the amount of oxygen in the blood while the lungs are wet. Monitor lung sounds and breathing effort regularly. Rationale. Crackles, wheezing, or increased work of breathing can mean fluid is getting worse. Administer diuretics, e.g. furosemide, as ordered. Rationale. Diuretics pull extra fluid out of the body and lungs, easing breathing. Teach encourage pursed lip breathing. Rationale. slows breathing and helps keep airways open longer so more air gets out and in. Expected outcome: patient keeps oxygen saturation greater than or equal to 92%, reports easier breathing, and lung sounds improve. Nursing diagnosis number 2, decreased cardiac output. Related to weakened heart pumping ability, as evidenced by fatigue, weak pulses, low blood pressure, cool extremities. Interventions and rationales: monitor vital signs and heart rhythm closely. Rationale: changes in heart rate/rhythm or low blood pressure show the heart is struggling. Give prescribed meds, ACE inhibitors, beta blockers, diuretics. Rationale: these drugs reduce the heart's workload, improve pumping, and remove extra fluid. Cluster care and provide rest periods. Rationale: rest saves energy so the heart doesn't have to work as hard. Monitor urine output. Goal greater than or equal to 30 milliliters per hour. Rationale: good urine output means blood is reaching the kidneys. Low output may mean poor circulation. Assess for edema and daily weight changes. Rationale: swelling and sudden weight gain are early signs of fluid overload and worsening output. Expected outcome: stable heart rate and blood pressure, warmer extremities, improved energy, and adequate urine output. Nursing diagnosis number 3, excess fluid volume. Related to hormones and poor pumping causing sodium/water retention, as evidenced by edema, crackles, shortness of breath, rapid weight gain. Interventions and rationales: record daily weight at the same time each day. Rationale: a fast weight jump shows fluid is building up before other symptoms appear. Monitor intake and output I and O. Rationale: tracking what goes in and out helps judge fluid balance accurately. Restrict sodium and fluids as ordered. Rationale: less salt and fluid prevent the body from holding on to extra water. Elevate legs when sitting. Rationale: helps fluid move back toward the heart, reducing ankle/leg swelling. Administer diuretics and check potassium as ordered. Rationale: diuretics remove fluid. Some can lower potassium, so levels must be watched. Expected outcome: reduced swelling and lung fluid, easier breathing, and stable or decreased weight. Complications and nursing priorities. Complications can be life-threatening, so nurses must recognize them early. Pulmonary edema. Too much fluid backs up into the lungs. The patient may cough up pink, frothy sputum and struggle to breathe. Nursing priority: sit the patient upright, apply oxygen, and prepare to give diuretics immediately. Kidney failure. Because the heart isn't pumping enough blood, the kidneys can shut down. Nursing priority: monitor urine output and creatinine levels closely. Cardiogenic shock. Severe drop in blood pressure and poor tissue perfusion. Nursing priority: monitor vital signs, administer medications to support blood pressure, and notify the provider immediately. The biggest nursing priorities for CHF are airway, breathing, and circulation, making sure the patient can breathe, has enough oxygen, and that fluid isn't overwhelming the heart or lungs. Patient teaching points. Daily weights. Weigh yourself every morning after using the bathroom. A gain of more than 2 to 3 pounds in a day or 5 pounds in a week can mean fluid buildup. Low sodium diet. Avoid salty foods like chips, canned soups, and processed meats. Too much salt makes the body hold on to water. Fluid restrictions. If the doctor limits fluids, measure all drinks and ice chips. Take medications as prescribed. Common ones are diuretics like furosemide, ACE inhibitors, and beta blockers. Don't skip doses. Rest between activities. The heart needs time to recover. Call the doctor right away if you notice more shortness of breath, coughing at night, swelling, or weight gain. NCLEX Style Practice Questions. Question 1. A patient with CHF complains of shortness of breath when lying flat. Which nursing action is most appropriate? A. Have the patient lie flat to rest. B. Place the patient in high Fowler's position. C. Encourage the patient to increase fluid intake. D. Restrict oxygen use to prevent dependence. Correct answer, B. High. Fowler's position helps the lungs expand and makes breathing easier. Why others are wrong? A. Worsens breathing. C. Adds more fluid overload. And D is incorrect because oxygen is helpful in CHF. Question 2. Which lab value would the nurse expect to be elevated in a patient with heart failure? A. BNP, B. Calcium, C. Hemoglobin, D. Chloride. Correct answer, A. BNP rises when the heart is overstretched and struggling to pump. Why others are wrong? Calcium, hemoglobin, and chloride are not specific indicators of heart failure. Question 3. A patient with CHF gains 3 pounds overnight. What should the nurse do first? A. Document the weight and reweigh in the morning. B. Call the provider to report possible fluid retention. C. Encourage a high sodium snack. D. Hold the morning diuretic dose. Correct answer, B. Notify the provider. Rapid weight gain suggests fluid buildup. Why others are wrong? A. Delays intervention. C. Adds more fluid retention. D. Worsens the problem by holding the diuretic. Question 4. Which dietary choice is best for a patient with heart failure? A. Canned soup and ham sandwich. B. Grilled chicken with steamed vegetables. C. Pizza and cola. D. Instant noodles with soy sauce. Correct answer, B. Grilled chicken with steamed vegetables is low in sodium and heart healthy. Why others are wrong? A, C, and D are all high in sodium and fat, which worsens CHF. Question 5. Which finding shows that the treatment for heart failure is working? A. Weight gain of 4 pounds in a week. B. Urine output increased to 1,500 milliliters per day. C. Increased shortness of breath at night. D. New swelling in ankles. Correct answer, B. Increased urine output means the body is getting rid of extra fluid. Why others are wrong? A, C, and D indicate fluid overload and worsening, CHF. Quick summary. CHF means the heart can't pump blood effectively. Left-sided equals lung symptoms, right side equals body swelling. High BN, P levels, and fluid retention are key signs. Nursing priorities: help the patient breathe, remove extra fluid, and monitor weight. Teach patients to weigh daily, limit salt, and report swelling or weight gain. This is Nurse Anna from nursestudy.net. I hope this video helped you understand the pathophysiology and nursing care for congestive heart failure. Remember, understanding why things happen will always make nursing easier. Visit nursestudy.net for study guides, care plans, and NCLEX practice questions. Keep studying smart, and I'll see you in the next lesson.